All right, so we're going to demonstrate the cervical myelopathy cluster here. So just going to check a variety of different tests. Each individual test, if it's positive, basically indicates an increased risk of cervical myelopathy. The first thing that we'll try here is going to be the Hoffman's test. So I'll take the patient's hand here, and we'll just kind of support across the fingers. And what I'm going to do here is flick this third digit, just like that. And what I'm watching for is for that first and second finger, the thumb and the forefinger, to kind of flex forward. And if they did flex forward, that would be positive, but we're not getting that, so that would be negative. Second thing we're going to check is going to be the Babinski reflex. So I'll have you just slide back on the table a little bit, put your foot up. So for this one, just take kind of a pointy object, the back of the reflex hammer will work perfect. And we're just going to slide that along the bottom outside of the foot and then up towards the toe. And when we do that, you see that his toes flex forward a little bit. If they were to fan out, that would be a positive test. So again, that was negative. The next one that we're going to check here is going to be the inverted supinator sign. So I'm going to be checking his brachioradialis reflex here. So we'll just kind of support the arm, and then we'll tap the brachioradialis. So he's getting a normal reflex response there. If it were to flex forward or go the opposite direction, that would be a positive test. But again, it is negative. The next thing I would do is ask the patient to walk, just to check his gait pattern. Okay. So maybe a little bit ataxic there. We're looking for any type of clear gait abnormality as a positive test there. So let's just call that one positive in this case. And then the last part of this test is the patient's age. So over 45, let's say that he is in this case. Over 45 would be a positive risk factor, so that would increase the risk. That would be another point on the test. So in the end, if we have 3 positives out of 5, that indicates a 94% chance that cervical myelopathy is present. In this case, he has 2, so we would not say that that 94% is the case.
Today we're going to do 2 tests to examine a couple of the muscles in the hip. So the first test we're going to do is the psoas test. So I will instruct the patient to do a single leg raise with their right leg, so just raise your leg in the air. If the patient experiences pain with this movement, the test is positive and would indicate an abscess or infection on the psoas muscle. You can relax. With the second test, the obturator test, it's a very similar thing, except I will passively bring the leg up into flexion here. To test the obturator externus muscle, I will internally rotate the leg, and to test the obturator internus muscle, I will externally rotate the leg. If pain is experienced with either of these motions, the test is positive and will indicate an abscess or infection on the corresponding obturator muscle. Likely I would do this test if the patient was presenting with any sort of injury that seems to be non-musculoskeletal in nature. And that's it. Okay, so today we're going to be performing the olecranon manubrium percussion tap test. This test is used to rule out the possibility of a fracture or dislocation anywhere from the manubrium on down to the elbow. So we'll start by having the patient cross their arms at 90 degrees. Perfect, just like that. I'll place the stethoscope on the manubrium. So then I'll start by gently tapping the right elbow. If there's no fracture or dislocation, I should hear a crisp sound and intensity. I'll move over to this side to test the opposite limb. Again, tapping gently right on the elbow and hearing a crisp sound on both sides. If the test were positive, I would hear a dull sound and intensity, indicating the likelihood of a fracture or dislocation. Yep.
All right, we're going to demonstrate the fulcrum test. So this test would be performed if you have suspicion of a fracture in the femur. Basically, pretty simple test. You're just going to place the patient in a seated position like this. Kneel down and bring one arm underneath, just proximal to the distal end of the femur, creating a fulcrum. That's the name of the test. And then with this position, you're going to apply a downward force on the distal end of the femur, creating a shearing force. So just like so, take up the soft tissue first and then kind of apply that force to the bone. A positive test would be indicated by a sharp pain or apprehension felt by the patient, and this would just indicate that a fracture is likely present.
Okay, so today we're going to do the patellopubic percussion tap test. This test is usually used in the case of trying to rule out the possibility of a fracture anywhere from the patient's pubic bone on down to the patella. So starting out to do this test, I'll have the patient place the stethoscope on his pubic bone. Once the stethoscope is placed, I'll begin to gently tap the patient's patella on one side. And now the other side. I should hear I should hear a crisp sound in both pitch and intensity. In the case of a positive test, one of the sides would demonstrate more of a dull sound in both pitch and intensity, demonstrating likely the possibility of a fracture.